Greetings, everyone. Thank you to the Global Center for Health Diplomacy and Inclusion, CEDI, CNS, and partners for organizing this important She and Rights session today. Only 54 months are left to deliver on the promise of gender equality, the SDG 5, and health and well-being, which is SDG 3, by 2030. But the sense of urgency and purpose is missing if we recognize that the world is not on track to deliver on either of these goals. Instead of going forward, in many instances, we are spilling backwards. Gender equality and human rights to health are fundamental human rights, and both are indivisible or inseparable. But despite this, anti-rights and anti-gender pushbacks have been growing, stalling, and at times trying to reverse whatever progress has been made on gender and health rights, especially for girls and women and gender diverse communities. The regressive draft African Charter on Family, Sovereignty and Values is yet another assault on sexual and reproductive health rights and justice, as well as bodily autonomy and human rights in general. More importantly, this draft charter urges African governments to withdraw from progressive and rights and evidence-based agreements, including the historic and legally binding Maputo Protocol of 2003, which has been playing a defining role in promoting gender equality as well as protecting reproductive and health rights of women and girls in Africa. Among growing global anti-rights and anti-gender pushbacks, this draft charter is an additional attack which is attempting to backslide progress made on gender equality and human rights to health. This draft charter is the first African continent-wide patriarchal push to dislodge human rights and replace rights with so-called moralistic viewpoints. We cannot undo progress made by years of dedication and decades of struggle, which have resulted in strong and legally binding commitments, such as those enshrined in Maputo Protocol. Governments need to disengage with this draft charter and instead honor and deliver on the promises they have made on gender equality and human rights to health, where no one is left behind. And these are international human rights laws which are binding and have human rights obligations on states. This draft charter wrongly claims that sexual and reproductive health, rights, and justice are so existential threat to African communities and families. The reality is totally the opposite. It is patriarchy and anti-rights and anti-gender pushbacks that are threatening to become an existential threat to African families. Not autonomy, not respect, not dignity, not equity. And globally as well, if we see with rights and justice for our rights, women and people in all diversities, we will see this pushback. Whether it is comprehensive sexuality education or the right to safe abortion, these are hard-fought gains, despite and in spite of anti-rights pushbacks. We cannot let these gains on gender equality and the right to health wither away. Governments must disengage and reject such a regressive attempt. This draft charter is trying to prioritize so-called family over individual rights, which risk legitimizing subordination of girls, women, and gender diverse people. Such a regressive attempt will also wrongfully firewall families from accountability in situations such as violence, coercion, or discrimination, making it impossible for vulnerable girls, women, and gender diverse people to seek justice where needed. It also wrongfully defines what a family is. I would like to close with the remark that gender justice and human rights to health are not negotiables. Rather, these are essential bedrock for human development, for sustainable peace and security. I thank you.